Observation starts with when you first see the patient. And for me, it's often in the consulting room, starting with observing the dog at rest. Often the resting position can give you clues as to problems that may be present. A very informative part of observation is observation of the standing dog. And I usually do this while I'm having a conversation with the owner, keeping one eye on the dog, looking at body position, looking to see whether weight is shifted forwards or backwards, looking to see whether one particular limb is being favored or rested. The final part of observation is the observation of gait or of movement. And very often I will make that observation while the dog is being moved from the waiting area into the consulting room. Rarely do I need to perform a formal gait evaluation outside, along a path, or in a hallway. Okay, so let's start the orthopedic evaluation. Now remember, the first part of the evaluation is observation. And in fact, a lot of the observation and the orthopedic, the hands-on orthopedic evaluation, I would normally do with the dog on the ground. But for the purposes of today and demonstration, at times we'll have the dog up on the table here. So, during observation, if you remember, we're going to be observing the position at rest and the position standing and the evaluation of gait or movement. In order to observe the position at rest, I'll often encourage dogs to sit down and to lie down. Sit down, go. Sit down. Sit. And you can see that was a nice square sitting position, the legs tucked equally underneath. If this dog had sat down and this one limb had been kicked out to one side like that, then that, for example, may be indicative of stifle disease, particularly cruciate ligament pain. Lie down, go. Lie down. And in the lying position, dogs, a normal lying position for dogs is to have the limbs out in front of them like this. If this limb was curled around, tucked in like this, similar to the way a cat might sit, then that might be indicative of elbow pain. So you can see there are a number of pointers as we observe the resting position that can lead you to start to think particular joints may be affected by orthopedic disease. So the second part of observation is observation of the standing position. And what we're going to be looking at here is the way the body is held, how limbs are being used, and start to get an overall assessment of muscle mass. In the normal standing dog, the hind limbs should be positioned under the hip joint, and the manus, the distal part of the forelimb, should be positioned under the shoulder joint. If, for example, the distal forelimb is positioned caudal to the shoulder joint, that would indicate that weight has been shifted forward. Similarly with the hind limb, if the hind limb, distal hind limb, is positioned caudal to the hip joint, that would suggest that weight is being shifted forward. Another great indicator of forward shifting of weight, which is really common in dogs, is a lack of flatness or a lack of lordosis of the back. Lordosis is that dip that dogs should ordinarily have in their back. If the back looks flat and even curved like that, that's indicative of weight being shifted forward. The dogs are arching their back to shift that weight forward. And that's indicative of hind limb problems. Now, a slight curve in the back, something like that, might be associated with hip pain. A more pronounced curve, a more pronounced shifting of weight forward is more usually indicative of stifle pain, stifle disease, because stifle disease is less well tolerated by dogs. We can also, in the standing position, evaluate limb use. Often people talk about evaluating limb use during gait, but limb use, body weight distribution, is a great, during the standing position, is a great way to evaluate limb comfort and limb use. And what we're talking about here is, as the dog relaxes, as it's standing in the consulting room, if you see a slight offloading of the limb, such as I'm demonstrating here with the forelimb, or with the hind limb, just very subtle like that. That's offloading or favoring of that limb, and that's indicative of the main problem being in that limb or those limbs. Also at this stage, we start to get an overall assessment of muscle mass, just visually. We're looking for obvious muscle atrophy, say over the shoulder region, that might be indicative of forelimb discomfort, or over the hind limbs, such as in the hamstring area here, which again might point to a hind limb problem. And muscle atrophy is a great indicator of overall comfort over a period of time. Muscle atrophy indicates use of a body part, so it's a great indicator of where there are problems. So now on to the third part of observation, which is the observation of gait or movement. And there are three things I'd like to draw your attention to that can be really helpful in determining which limb is affected. Firstly, if we start with what we call the head bob, which can be indicative of forelimb lameness. Now, the head weighs quite a bit, and as the uncomfortable limb hits the ground, in this case, let's pretend it's the left forelimb. As the left forelimb hits the ground, what dogs will do is to elevate their head to take the weight off this limb. Conversely, as the sound limb, in this case the right forelimb, hits the ground, the head will come back to the normal position. So what you see is a head bob, referred to as down on sound. It's actually up on unsound, but what we see is down on sound. Okay, so now let's take a look at an example of a forelimb lameness. And remember, what we're doing here is trying to determine when the head is going down, and that'll tell us the sound limb, and then conversely we'll be able to detect the unsound or the lame limb. So as the dog's moving along, we're looking at the head and we're looking at down, down. Let's look at that again. Down, 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 down. And as we're saying down, it's the limb that's hitting the ground when we say down that is the sound limb. Conversely, it's the opposite limb that is the uncomfortable one. In this case, the left forelimb is more uncomfortable than the right, and that is the one that we need to focus on. Okay, now let's look at a slightly more difficult example. This is a young dog here that's not gaiting particularly well. But what we're looking at is to see when that head bob is occurring, and particularly in this pass. Now watch now, you'll see the head go down at intervals. So down, 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 down. More difficult as we come towards us, but a couple of times there you see the head go down, and back again we see down, 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 particularly there. And again, we're doing the same thing. As we see the head go down, we then look at the limb that's hitting the ground, and in this case it's the left forelimb which is hitting the ground as we see the head go down. That means it's the right forelimb that is more severely affected in this particular case. The second thing I'd like to talk about is the hip wiggle. And this is associated with hip pain. The pelvic wiggle is associated with hip pain. Ordinarily, when dogs are moving forward, they'll flex and extend the hip joint. If that motion is associated with discomfort, then rather than flex and extend the hip joint, what dogs will do is to shift their pelvis to one side and then shift it to the other side in order to effect forward motion while minimizing movement of the hip joint. Let's take a look at a great example of this in this young Rottweiler. Now the first thing you see is that rounded back that we talked about earlier, indicative of weight being shifted forward. But more pronounced than that is this wiggle of the hips from one side to the other. And what this dog is doing is minimizing movement of the hip joint, but still effecting forward motion by swinging the hips to one side and then to the other. Now this is hard work, and dogs are only going to expend energy for something if they are avoiding a significant problem. So this whole abnormal gait is indicative of significant hip pain. Many of these cases are more complex than simple problems. Watch the same Rottweiler here descending the stairs in a very hesitant way. Now, as he turns around and goes up the stairs, I'm pleased to see the independent hind limb use here, particularly after seeing that significant pelvic twists from side to side. But watch again as he goes down the stairs. This hesitancy in going down the stairs in a young male Rottweiler that should be bounding down the stairs is indicative of bilateral forelimb discomfort, in this case due to elbow dysplasia. Now, as he turns around here, watch this, bunny hop, bunny hop, bunny hop. You see, that again is confirming the diagnosis of hip dysplasia and hip osteoarthritis associated with significant pain. So our diagnosis in this case after arthroscopy was of bilateral elbow dysplasia and bilateral hip dysplasia and OA. And then finally, let's talk about pelvic roll. And this can be useful in determining which side is more affected than the other. Pelvic roll refers to the up and down excursion of the pelvis as you watch the dog from behind. And the way to determine which leg is more severely affected is by watching this pelvic roll. And as you see the pelvis come up, the side that comes up more than the other just before the hind limb hits the ground, that's the side that's more severely affected. What these dogs are doing are trying to shift weight from the affected side, in this case the left hind limb, from the affected side across to the other side just before the limb hits the ground. And so what you see is this shifting upwards of the affected side just before that limb hits the ground.